Now, the third regular hospital diet is a soft diet, and soft diet is something that everyone knows. We prepare such soft diets even at home, right? Be it regular fever or flu or any disturbance that our body faces, there is sure change in the form of the food that we take, especially the consistency, right? You must have seen people, or you yourself have consumed the food that has been changed into softer consistency. The reason for changing them into softer consistency is to provide rest to the body. That is one of the objectives of diet therapy. How is it providing rest to the body? Is when the consistency is being changed to soft, the body will not have the stress of carrying out the process of the regular digestion. Fine. The food is made simple for the digestion and absorption, and that way the body is being provided with little rest. Fine. Now, we give this soft diet, as I told you, in cases of a condition where the diagnosis is yet not done, and but the individual has some or the other health issue, but the diagnosis is still not done. So in such case, it is soft diet that is preferred. It is also preferred when the individual has initially been consuming clear liquid diet and then got shifted to a full fluid diet and is tolerating a full fluid diet, and the needs of the body still has to be met, and then there is an addition, or there is a change in the pattern of the diet, and that is the soft diet that comes in picture. Fine. So this diet is given to the conditions in pre and post operation, during various infections and uh, dental issues, inflammations, or it could be in condition where the individual feels anorexia. Fine. In all these conditions, this soft diet is given. Fine. Now, this soft diet is regarded as one that bridges the gap between acute illness and convalescence. Fine. It is good. It is bridging the gap between acute illness and convalescence. Acute illness is that sudden, or that what do we say, illness that has suddenly occurred to the body is acute illness, and convalescence is the recovery period. So the diet that is provided in between acute illness and convalescence is a soft diet. Fine. There are few things that are to be kept in mind while preparing soft diet. As you remember, while we were discussing clear liquid and full fluid diet, there were few things that we considered. Like in clear liquid diet, there was no milk to be provided. It had to be clear liquid. Whereas in full fluid, there was milk to be provided, but there was no solid food that had to be given. Fine. Now, this soft diet is the similar regular diet that we suggest. Fine, that everyone consumes, but there are few specifications or few instructions to be followed while preparation of the soft diet. As it says, it has to be prepared by easily digestible food. Fine. The consistency has to be soft, and easily digestible foods has to be selected. Fine. Something which has low fiber in it. Fine. Something that has low fiber in it and that is easily digestible, and something that has low fat in it. There should not be additional fat or butter or lard or anything that is to be added. The bakery items are avoided over here. Fine. Though there are many bakery items that are soft, but they have good amount of fat. So all those foods that are high in fat, that is high in fiber, and that holds complex carbohydrates where it involves the regular digestion, All these foods has to be avoided. So when a diet is being prepared, it has to be a simple, easily digestible food, excluding fiber, very low amount of fat, and if seasoning is done, very less seasoning has to be done. Fine. These are the measures or the instructions to be followed while preparation of a soft diet. Now, if we prepare a soft diet, of if we plan a soft diet considering a regular diet or keeping in mind the regular diet that everyone consumes, like keeping that in touch and preparing a soft diet, then the calories that it provides is will come to around 1500 kilocalories, and around 40 to 45 grams of protein will be provided through this soft diet. Understanding, everyone? So this is all about soft diet. After the soft diet is a normal regular diet that is given to any individual, be it in hospital or be it at home, or for ambulatory patients or for the bed patients. These diets or the regular homemade diets are given. That is one fourth diet that is not so important is being provided. Fine. Now here the next slide gives you the clear picture of the difference between a clear liquid diet, a full fluid diet, and a soft diet. Now, as clear liquid, full fluid, and soft diet, the differentiation we have studied, you can just look through the difference between the food items that can be prepared. Fine. There is various foods that can be given in clear liquid like coffee and tea, and it has to be non-carbonated beverages. Fine. The fruit juices has to be clear, that is strained, and from cereals and pulses. Those food groups, the food items that can be prepared is something like kanji. I told you the other day, that is pinch. Fine. The dal water, not the dal soup. A soup is different from dal water. Fine. The water that floats up on the dal when it is kept for some time, that is very thin dal, is referred to as dal water. That is given as a clear liquid. Fine. Whereas a proper the soup, the dal soup, comes under full fluid diet. Fine. Then we have barley water, whey water from milk. Fine. The whey water from milk, the fruit juices, the plain fruit juices, as in strained fruit juices with egg white in them, also is a part of clear liquid diet. Then we have tea and coffee without milk. Fine. All these are the items that can be given under clear liquid diet. Whereas under full fluid, it is the same similar foods that can be given for uh, the full fluid and the full fluid, but here milk is allowed, here puddings are allowed, here ice cream is allowed, custard is allowed, then tea and coffee with milk is allowed. Fine. Then the fruit juices unstrained are allowed, the proper dal soups are allowed. From cereals and pulses, the cereals, porridge, and gruels. Gruel is nothing but gulati, and porridge is nothing but harira. Fine. All these food items are allowed under full fluid diet. Then soft diet includes all the clear liquid, full fluid, plus the softened regular meal like ripe banana, or it could be the minced meat, minced poultry or fish. Fine. It could be custards, kheers, puddings, or the fruit juices or vegetables that are grinded and pureed, the mashed regular diet. All these comes under soft diet. But the thing to be kept in mind of considering a soft diet is it should not have high fat content in it, and it should be less in fiber. Fine. So this is all about clear liquid, full fluid, and soft diet. Now Next, we study about special feeding methods. I hope the things that we have studied until now is clear to everyone. Fine. Now, these diets that we had studied was for a regular patient who gets admitted in the hospital, and these diets are suggested when they are shifted to their regular wards, or they still has to get shifted, they still has to get to the hospital, as in during pre-operation or post-operation, those diets are preferred. Fine. But in cases where the condition of an individual is very bad, very severe, where he or she is not in a condition to consume any regular diet, be it clear liquid or full fluid or soft, any diet is not being readily taken up by the patient, then there are various special feeding methods that are applied for the supply of food. Fine, that are applied for the supply of food. Now, this is also called as nutritional support system. Fine. Now, this nutrition support system is provided in cases where in few conditions it is provided. One such condition is when the patient previously was very fine, but has immediately showed up various complications of multi-organ dysfunction or infection or trauma or cancer. Initially he was fine, but there is sudden a diagnosis of all these conditions, then the special feeding methods are applied. Or in cases where the individual has not been consuming the regular food pattern or not consuming food for more than 7 to 10 days. Fine. So in these cases, the special feeding methods are applied. Fine. Now, these special feeding methods are based on the severity of the condition and the activity of gastrointestinal tract. Fine. Depending on how severe the condition of the patient is, and is his gastrointestinal tract in working position or not, based on these two criteria, the critical care unit has suggested or has decided two types of feeding methods. There are enteral and parenteral. Fine. As you see, enteral, enteral, and the next one is parenteral, parenteral. Fine. Now, enteral and parenteral are two types of feeding methods that are provided to patients that are there in ICU, SICU, MICU. Find all these critical care unit system go either with enteral nutrition or parenteral nutrition. The main difference, the the dividing difference between enteral and parenteral nutrition is, enteral is the one that uses the path of gastrointestinal tract. Fine. As in, the gastrointestinal tract is being used during the process of supply of nutrients to the body. Understanding? Everyone uses their gastrointestinal tract for the supply of nutrients, and there is the process of digestion and absorption taking place through that route. Fine. So in cases where the gastrointestinal tract is used for the supply of nutrients, that feeding method is referred to as enteral nutrition. Understanding? Whereas parenteral nutrition is the one where the regular drips are applied as the source of energy or as the source of nutrient directly into the veins, and the gastrointestinal tract is not being used. Fine. That is the difference between enteral and parenteral nutrition. So enteral nutrition you can also define as The enteral means within or by the means of gastrointestinal tract. Fine. And enteral could be oral. Fine. Where we'll discuss in the next slide, where there is the provision of tube, or there is, a tube getting passed to the gastrointestinal tract from the mouth, from the oral cavity. Fine. So here oral cavity or mouth is being used in enteral nutrition. Fine. Whereas in parenteral nutrition, it is directly the veins that are supplying the nutrients, and that are so simple that they are absorbed. There is no digestion process. It is only absorption process taking place in parenteral nutrition. Fine. Now, enteral nutrition is the one, as we discussed just now, that is using or by the means of the gastrointestinal tract, within or by the means of gastrointestinal tract, is enteral nutrition. Here it says that when the gut or the gastrointestinal tract of an individual is working, fine, then it should be used. Fine. When the gastrointestinal tract of an individual is working, it should be used. And it could be used, and oral feeding can be done or tube feeding can be done. That we'll discuss after this. Fine. But uh, but this enteral nutrition is also provided in cases where the individual can take the food orally, but due to anorexia or unwillingness to consume the food, he is not ready to consume the food. In such cases also, the enteral nutrition is provided. And the benefits of providing or applying enteral nutrition is, it retains the epithelial structure and function of the gastrointestinal tract. So if there is, this is the one example that I'm giving, if there is some what do you say, machinery at home that is in working state, and only if and when you keep using it regularly, it will stay in proper condition. Fine. And if it was initially in a good condition, a newly brought some machinery that was in perfect condition, but you had not been using it for the longest of time, and then you tried to use it after ages, you think it will work? No, it will not work, because it has gone various changes or whatnot, but it is not going to work. Fine. The similar case with gastrointestinal tract. That is why it is said that when the gastrointestinal tract is in functioning condition, then it has to be or it should be utilized. Fine. Or else it will cause various epithelial and structural and functional damage to the gastrointestinal tract. Something like when you don't use it, then it becomes of no use. Fine. And when you keep using gastrointestinal tract, the immune response, the mucosal immunity, and the regular blood flow increases. It becomes normal. The immunoglobulin A is released by the gastrointestinal tract, that increases the immunity of the individual. Fine. There is epithelial proliferation, that is nothing but the production of new cells, helping in the growth and flourishing of the gastrointestinal tract. The proper mucus integrity is maintained, that is good amount of mucus is being supplied by the mucosal lining. That mucus that is supplied becomes as a shield, and it becomes as a barrier, keeping away the growth of various microorganisms. And it also decreases apoptosis in the gut. Apoptosis is nothing but the regular death of the cells that take place during the course of mitosis and meiosis for the regular growth and development of an individual. So it also decreases apoptosis, that is it helps in the maintenance of the gastrointestinal tract, and reduces the various biochemical changes that take place, that is causing the death of various cells of gastrointestinal tract. Fine. So for these reasons, the enteral nutrition has to be applied or has to be opted in condition where the gastrointestinal tract is working. Fine. Now This enteral nutrition is of two types. The first one being oral feeding, the second one being tube feeding. I request everyone to make a note of what is being told just now. That is, mm, the special feeding methods are there. They are of two types. The first one is enteral feeding, the second one is parenteral feeding. Fine. Now, this enteral feeding is of two types again. The first one is oral feeding, and the second one is tube feeding. Fine. Now, for any patient who is being admitted in the hospital for any condition, and if his or her gastrointestinal tract is working, and if there is if the individual can tolerate the oral feeding, then oral feeding has to be suggested. Fine. But in cases where there is lack of appetite or anorexia, or the individual is unable to drink or eat, then the tube feeding is suggested. Now, when oral feeding is suggested, the feed that is given is the various pharmaceutical sachet that are available, that has emulsified nutrients in that, providing about 200 kilocalories of energy, 2 grams of nitrogen, that is almost equivalent to protein, in about 2 ml sachet of in 2 ml of sachet. Something like glucon D powder. Fine. What do we do? It says that it provides energy. Fine. It comes with a label saying that it provides energy. I'm giving that as example. Don't write in the exam that glucon D is one of the oral feed. This is for your understanding purpose. The example is being told. Now, as glucon D is supplied, what is done? That powder is being taken and it is mixed in water in the prescribed amount that it is said. It is mixed in water and it is given to the individual. The similar way are the oral feed sachet that are available in various pharmaceuticals, where that provide one sachet of 200 ml, provide around 200 kilocalories of energy and 2 grams of nitrogen. The method of giving it to the patient is, there is a prescribed amount and quantity with the ml of water. It has to be mixed in, and it is just mixed in water as 2 scoops in 200 ml of water, or 4 scoops in 200 ml of water, whatever the prescription is. It is mixed in water and it is given as sips orally to the patient. Fine. And it is said that pre-operative sip feeding enhances post-operative recovery and reduces hospital stay. Fine. So when the individual is taking the food or taking the meal or consuming the nutrients orally through sip feeding, then there is this method providing the substrate the power of healing, and that will reduce his hospital stay. Fine. That is all about oral feeding. But in cases where oral feeding cannot be provided, fine, the various conditions where oral feeding cannot be provided, where the individual cannot swallow due to paralysis of the muscles of the oral cavity, or due to cancer, or the individual who has anorexia problem where you have to force him or her to eat, or the individual who is in semi conscious or unconscious condition, or there is malabsorption, or there is gastrointestinal disturbances he or she is undergoing, or it could be conditions like post surgery or severe diarrhea, or to babies who are of low birth weight. In all such cases where, even if you want, even if you try, oral feeding cannot be given. Fine. In all these cases that I discussed, that is anorexia, severe diarrhea, post surgery, or any paralysis to the muscles of mouth, or cancer, fine, or any renal disorders, fine, or any damage to the gastrointestinal tract where the gastrointestinal tract is not working, In all such cases, oral feeding cannot be given. So in such cases where the oral feeding cannot be given, then we opt for something known as tube feeding. Fine. Tube feeding is the second type of enteral feeding. Fine. As the term says, tube feeding, there is the involvement of tube during the process of feeding. Tube plays a very important role in feeding an individual. Fine. Now, this tube feeding is suggested in cases where oral feeding cannot be possible. Fine. In cases that I discussed just now. Now, as you see in the picture, a tube is being passed from the nose. You see in the picture, a tube is being passed from the nose and it is reaching the stomach. Fine. Now, this type of feeding where there is passing a tube into the stomach or into the duodenum or jejunum. Fine. Into the duodenum or jejunum, that feeding is referred to as naso, from nose, gastric to stomach. Fine, is referred to as nasogastric feeding. Understanding? The feeding that involves the passing of tube from nose to stomach is nasogastric feeding. If it is from nose to duodenum, then it is nasoduodenal feeding. If it is from nose to jejunum, then it is nasojejunal feeding. Understanding? I'll repeat it again. This type of feeding, this type of tube feeding involves the passing of tube from nose to the stomach. Fine. There is a tube that is being passed from nose to the stomach. Fine. And that feeding is referred to as nasogastric feeding. If the tube is being passed from nose to duodenum, it is nasoduodenal feeding. If the tube is being passed from nose to jejunum, it is nasojejunal feeding. Fine. Now, this tube feeding, that is nasogastric or nasoduodenal or nasoduodenal feeding, is opted for a very short period of 3 to 4 weeks. Fine. If the